Okay.
Go ahead.
So this right here, lung anatomy, and this is just the basics. There's more to it than this, but we just want to give you an overall perspective of it. So we're going to draw sort of a dome-shaped chest cavity here. Okay. We're going to draw another little dome at the bottom. And this is a muscle. It's a wide, flat, smooth muscle, folks. What's this one called? Diaphragm. Super duper important. It's spelled diaphragm for some reason, but super duper important for your ability to inhale. As we found that air going in was the effect and not the cause. Now you've got two lungs. How would you name them?
Left lung and right lung.
Good, because that's how they name them. All right, so let's draw a lung in here, taking up a fair amount of space like that. And then draw a lung on this side, but we got to put a big old notch excuse me, in this side right here. And come back up like that. Now, lung kind of comes to a point at the top, not a real sharp point. Kind of like your heart comes to a point, but not a real sharp point. What do we call that point on the heart? And that's what we call it here. The apex is the top of the lung. The bottom of a lung is called the, this is real simple, it's called the base. Oh, it gets even easier. You're going to thank the anatomy student that was you first semester for knowing this anatomy, because a lot of it's very logically named. Which lung is this? Left. And this is right lung. Okay. Now, as you notice when we inflated the lungs back there in lab, that they sort of divided out. What did they divide into? What were those names? What was the names of those individual pieces? Did I say it? Starts with an L. Lobes. Good. Now the left lung is divided into only two lobes, okay? There is a groove that runs like this down the side of the left lung, and that divides them into, how would you name this lobe? That's right, that's what it's called, superior lobe. Down here is the inferior lobe. Good. All right. Now on this side, we're going to divide it into three parts. It's going to be a line that goes like this, and then one that goes down at an angle like that. And of course, the one at the top is going to be the superior lobe. At the bottom, again, inferior. What are we going to call the other one, folks? Careful.
Mr. Helly?
Yes?
Dana Smith, come sign out, please.
Okay.
Thank you.
Okay. All right. That'd be nice on the video. This. All right. So here we go. What would you call this one? So simple. Yep, that's what it is. Middle lobe. Okay. Now these grooves here, they're long grooves or openings, and we've used this term before for a long, kind of deep groove. It starts with an F. Fissure, good. Okay, this is called the oblique fissure. The reason it's the oblique fissure is because it runs downward at an angle, just like your oblique muscles in your abs run downward at an angle, or the musculature inside the stomach is oblique, which means that top or bottom on this side is going to be oblique. Bottom is, okay. I'm running out of room here where to write this. but here we go. Oblique. Whereas this other fissure runs parallel to the ground. What would you call that?
Horizontal?
That's exactly what it is. Horizontal fissure. Okay. Now, there is this notch kind of dug out where the the apex of the heart points in. What's the anatomical word for heart? Cardiac, right. This is seriously just called the cardiac notch. I know, notch, not really a sciencey word. Okay, couple other things I want to add. All right, this space right here, okay, the space between the lung and the chest wall is called the pleural cavity. Not spelled like plural, like more than one in English, P-L-E-U-R-A-L. So the pleural cavity is interesting because it is a vacuum. Though your lungs are full of air and air moves in and out of your lungs, this space surrounding the lungs has actually a negative pressure. This space is it's not a perfect vacuum like space, but it's evacuated. And there's two different types of pleura. Pleura are the tissues that line the lung and the chest cavity. So let's look at this pleura. There is one that surrounds the lung. It's called the visceral. Visceral pleura is the tissue layer, saran wrap, that covers the lung. Okay. But in addition to that, we have one that lines the chest cavity, and that's called the parietal pleura. Okay. Question.
What does it say? Parentheses?
Oh, like saran wrap. Yeah. So visceral pleura and parietal pleura. And the space in between the two is called the what again?
Middle.
Ha, it's a good guess. That's not it though. It's up here.
Pleural.
Okay, that's right. So surrounding the lung, folks, the whole lung is packaged up in visceral pleura because the word visceral is a word that means organs. So it's the one that's covering the organ. And the inside of this space right here in the lung cavity is called the parietal pleura. And between the two is a vacuum. Touching the outside of the lungs, folks, besides squishy, how did they feel? Smooth and very slick. If they were, yeah, slimy is a good word for it. And the reason, folks, that they have to be is because these two walls are going to rub against one another. As your chest cavity expands and contracts, those two walls will come into contact. There's a fluid, an exudate, that is made by this pleural cavity called pleural fluid, and it has about the consistency of tears. Now, you think tears are mostly salty water, but there's actually a fair amount of fats and lipids in your tears that keep your eyes moist. But this right here, and that space, that fluid is made, not a lot of it, just enough to coat the lungs so that as your chest cavity expands and contracts, that there's no friction between the two. Occasionally there is, though, and sometimes you'll feel that. Like if you ever got like kind of a sharp pain, like breathing in, you know, not a side stitch, but like where like if you breathed in just a little bit, you felt kind of a pain in that chest cavity area, and then if you didn't breathe too deep, it didn't hurt, and then after a little bit it went away. So sometimes there's little rough areas in between there. Now I'm going to get into more detail of why this pleural cavity is so essential to our ability to breathe when I actually get into talking about how the mechanism works. But I'm not going to today. I'm going to finish with 2 words. Words for breathing, okay? We've learned the word inhale. Do you know a synonym for that? Check this out. That means to breathe in. And this is very, very old. Okay, this terminology is old. So what does it mean to breathe out then? Expire. Yeah. That's why when someone expires, they're dead. Okay? Well, how can milk expire? It doesn't breathe. Exactly. Right? Here's the thing. This is very, very old terminology. It goes all the way back to the, biblical creation in Adam, where and this is where this, because spirit and air were almost completely synonymous for thousands and thousands of years. When somebody breathed their last and they died, the spirit had departed them. If you go back to the old school, go to the biblical rendition of creation, God formed Adam out of the dirt and mud of the earth and then did what? Breathed into his nostrils the first breath of life. And so that's where spirit, I know that's church and state, but I'm just giving you some of the history of where these words came from. But if you think about it, then what you're doing when you really inspire somebody is you're giving them a breath of life. You're giving them some sort of spirit, or I don't know, something positive. So these are terms that are synonymous with breathing in and out. But again, we're going to look at next week how this actually happens and the mechanisms, the muscles, and the pressures and gas laws involved in this. Any questions?